Hello everyone, my name is Sonia. I am part of Group 5 and our topic is going to be cocaine. It falls under the class of CNS stimulants. Its generic name is cocaine hydrochloride. It is a Schedule II controlled substance with a high potential for abuse. Severe psychological and physical dependence can occur. So a little history about cocaine hydrochloride. Beginning in South America, cocaine was extracted from the plant Erythroxylon coca, and it was used by chewing the leaves and brewing in teas for over 5,000 years. In the mid 1800s, cocaine was considered safe. Common uses were toothache drops, nausea pills, energy tonics, and of course the famous and original Coca-Cola beverage. So some of the social impacts are listed here. By the 1920s, cocaine became the most feared and illicit drug. In 1914, Congress passed the Harrison Act, which was designed to tighten the regulations for the sales and distribution of cocaine. It is estimated that 50 million Americans, which is 1 in 4 Americans, have used this drug. It is estimated that 50,000 Americans every day try this drug for the very first time. More than 6 million Americans use cocaine on a daily basis. In the medical field, it is used in a liquid solution. It's administered prior to diagnostic procedures and surgeries as a local anesthetic. Common trade names are Goprelto and Numbrino. For illicit use or otherwise street use, it comes in a crystalline powdered substance form. Some of the effects are numbness and an excessive amount of dopamine. Common street names are Coke, Snow, and Blow. Prices per gram can vary from as little as $20 to $600 per gram.
Hi everybody, my name is Marissa Fessenden. I'm in Group 5 and our topic is cocaine. And my group members are Nehemiah, Omar, and Sonia. Today we'll be talking about the effects and risks of using cocaine. Cocaine is a powerful stimulant drug that affects the brain and body very quickly. While it can create short bursts of energy and euphoria, the risks that come with it are severe and often life-threatening. Body effects. Cocaine increases levels of dopamine in the brain, which is the chemical linked to pleasure and reward. This causes feelings of extreme energy, confidence, and alertness. Physically, people may experience increased heart rate, higher blood pressure, dilated pupils, and loss of appetite. However, the effects wear off quickly, which often leads users to take more and develop dependence, such as addiction. The risks, body risks. Risks of cocaine use are pretty serious, and in short term, it can cause anxiety, paranoia, and dangerous heart problems like arrhythmias or heart attacks. Long-term use is linked to addiction, nose damage from snorting, stroke, seizures, and severe mental health issues. Even one use can be deadly because cocaine raises the risks of sudden cardiac death. In summary, while cocaine creates temporary feelings like euphoria, the physical and mental and social risks far outweigh those effects. Understanding these dangers is important, especially because cocaine continues to be one of the most addictive and harmful drugs worldwide. And then I attached a video right here, so let me go ahead and play it.
When someone first uses cocaine, the drug quickly enters the brain, where it blocks the transporters on the presynaptic cell. Since dopamine cannot re-enter the presynaptic cell, it begins to accumulate in the synapse, where it can reach abnormally high levels and remain there much longer than usual. The postsynaptic cell becomes hyperactivated, which produces a feeling of euphoria. This creates an incredibly powerful association between cocaine and pleasure, making a person want to repeat the experience of taking the drug.
Nehemiah and I will be covering the pharmacology portion of our presentation. And I want to start it off by discussing the mechanism of action. So, how does it work? Well, once cocaine has been administered, it begins by binding and blocking off dopamine and other neurotransmitters inside the synaptic cleft. What this means is, because dopamine is being blocked off, it begins to build up in very high amounts, and when those high amounts are released into the brain, it creates a sort of enhanced version of dopamine. Well, what does this mean? Well, because dopamine is a hormone that brings already a sense of euphoria and pleasure, when there's an increased rush of that hormone, it brings a more intense feeling of that euphoria with high levels of energy. This helps create a feeling of numbness in a person, but it also creates a really high euphoric moment that a lot of people typically chase for. However, it is a short-term effect, which helps transition to our next slide, which is discussing how cocaine affects the brain. Because dopamine is released in high amounts and it creates a more intense feeling of euphoria, that euphoric feeling only lasts for a moment. And this can be considered to be a short term effect of cocaine. This can be included as well as high levels of energy, increased blood pressure, increased heart rate, dilated pupil, and muscle twitches are all short term effects that affect the body's physiological needs. So it impairs how the body works, how it functions, but besides how it affects the body, it also can affect the mind. Some of the psychological effects of cocaine include feelings of withdrawal, elevated levels of anxiety, stress, and paranoia, and an increase in aggression. This is due to the body craving. So when it's not being given the substance, it begins to lash out and it begins to affect a person's mind. Besides discussing the effects, there are different ways that it can be administered. In the sense of medical purposes, cocaine is administered as a topical anesthetic. It's usually applied in the mucosa membrane of ears, nose, and throats, and is commonly used in those exact same surgeries, such as rhinoplasties or surgeries involving the sinuses. And the reason it is administered as a topical medication is to help numb the area, but it also helps in preventing bleeding and hemorrhages that can be caused by surgery. While there is the beneficial purposes of using it for medical reasons, there's also the ways that it is administered for recreational purposes. In the sense of using cocaine as a recreational purpose, it's usually done in a powdered form, and in the powdered form, it is inhaled through the nose. This is referred to as blow or blowing, and once someone inhales the drug, it travels from the nasal cavity to the brain, which gives that euphoric feeling much more rapidly, including a burst of energy, which leads to this increased level of euphoria that people tend to crave when it comes to the
My name is
substance.
Omar Mora, and today I will be discussing the treatments associated with recovering cocaine addicts. Number one option is rehab. Generally, patients must agree to rehab, but in 35 states, it is possible for family, friends, or the court to place someone in involuntary rehab if it is deemed that they are not able to help themselves. Forms of rehab include therapeutic communities, contingency management. Another option is outpatient rehab. It is for patients who are at lower risk of withdrawal, and it is a more cost-effective method for people who cannot afford an inpatient option. It includes programs like PHPs, which are partially hospitalization programs, IOPs, intensive outpatient programs. It includes telephone-based counseling, cognitive behavioral therapy, and meeting with therapists. Detoxification from cocaine brings about withdrawal symptoms, which includes hostility, cravings, irritability, lethargy, depression, and insomnia. The first 2 weeks of detoxification are usually the hardest for the patient, and it can vary depending on the time of use, how long the substance was used for, and the dosages that were used. Another important key aspect of detoxification is having support groups. Sobriety itself is not going to address the underlying psychological and behavioral aspects of addiction. Behavioral therapies are necessary in order to achieve prolonged results. Environmental factors are family problems, bad influences, work life, neighborhood aspects. A support system that includes friends, families, and hobbies. Critical elements for securing sustained recovery from addiction are the support of their closest allies. Intense cravings and lack of coping mechanisms is usually what leads individuals to relapse.